Good evening. I love when every year we get this group together. The conversation goes on longer and longer each year, so I'm so happy to see that. So welcome to Cheers to You. We are happy to have everyone here today in person, and we have a few people joining us by Zoom, so welcome to you also on Zoom. I'm Amy Polsky-Larson, and I have the privilege of being the Chief Development Officer in the College of Pharmacy. And today we're here to celebrate you, our wonderful, generous donors who make incredible things happen in all three of our programs in the college: pharmacy, medical laboratory sciences, and occupational therapy. Your support of our students through scholarships, fellowships, student experiences, and research keep the University of Minnesota College of Pharmacy at the forefront of healthcare. If you've joined us in past years, you'll notice a little difference this year in our program. This year we're going to have more of a fireside chat with faculty and students from all of our programs. So to kick things off, I'd like to welcome our Dean, Kip Guy.
Thanks, Amy. It's great to see all of you. I think at this point I know roughly half of you well enough to put a face to a name. This was actually the first event I attended because it was happening right as I was in the middle of interviewing. So this will be my first annual appearance, and that feels a little weird to say. It doesn't feel like it's been that long, but I'm glad to be sharing this evening with you. I've been enjoying learning in college, getting to know the faculty, starting to think about what we're doing. If somebody comes running in through that door, you're supposed to tackle them. And if you don't know, we kicked off our strategic planning process a couple of weeks ago. So over the next year, we will be really deciding what our plan will be for the next 5-year period. And one of the charges I gave the groups who are leading the planning was reaching out to the community. So I would expect a good number of you should be talking to people in our college about community needs and the definition of those and what we ought to be doing. So I'll get back to the script, Amy, don't worry. I can see the side eye coming my way. This part of the job actually is one of the more enjoyable things. I get to facilitate communication. I get to meet people who have a tight connection to the college. It gives me an opportunity really in an event like this to acknowledge the generosity with which you've supported us and the impact that support has on our students, on our programs, on all the work that we do in the college. We don't say it enough. We are grateful to each and every one of you who donates to the college. Those gifts make things possible that wouldn't be otherwise. They support students who wouldn't be able to be here. And they enable us to get this job done in an increasingly restrictive environment. So thank you. So tonight, as Amy mentioned, we're going to do a little different programming. We'll have a panel of faculty and a panel of students who have been directly affected by the generosity of donors who are in the room. So thank you for being here. I hope you enjoy getting a chance to hear their stories. And I hope that this will inspire you to create a few more stories through your connection and generosity to the college. I'll hand back over to Amy.
If the faculty could join me up front now. I was telling one of our colleagues what the format was going to be for tonight, and she said, "Oh, you get to be Oprah." And I said, "Yes, I do." Well, I'd like to introduce our faculty panel to you, and we have people representing all of the programs we have in the college. So first, we have Dr. Gunda Georg. Dr. Georg is a Regents Professor in the Department of Medicinal Chemistry. She's the Robert Vince Endowed Chair, McKnight Presidential Chair, Director of the Institute for Therapeutics Discovery and Development, the ITDD, and faculty for the Medical Scientist Training Program in the medical school. Next, we have Dr. Corey McGee. He is an associate department head and associate professor in occupational therapy. Dr. McGee is a musculoskeletal rehabilitation translational scientist whose clinically relevant research objective is to improve the health and participation of persons with upper limb musculoskeletal disorders. Pretty good for a non-science person, huh? Me, I mean, not Corey. Next is Dr. Sarah Westberg, who is Associate Dean for Professional Affairs and Professor in the Department of Pharmaceutical Care and Health Systems. Dr. Westberg is the current president of the Minnesota Pharmacists Association. Her work specializes in women's health and comprehensive medication management. Next is Dr. Jennifer Brown. Dr. Brown is assistant professor in the Medical Laboratory Sciences program. Dr. Brown's primary focus is clinical toxicology and chemistry, particularly utilizing mass spectrometry. Oh, see, I did it myself. Okay, I'm going to skip the word, for drug analysis, medication compliance monitoring, and automated chemistry workflows. Special interests include using technology to work more efficiently, health informatics, and promoting the value of the medical laboratory science profession. Please join me in welcoming our panelists. I'm going to ask each of them the same question, and I'll ask you each question so you don't have to remember. So, Dr. Garrett, we're going to start with you. Can you give us your elevator speech or a short description on the work you're doing and what is revolutionary in your work?
All right. Well, thanks for that question. As you mentioned, I'm a professor in the Department of Medicinal Chemistry, so I do drug discovery research. And also, I'm the director, as she said, for the Institute of Therapeutics Discovery and Development. So we have actually in the Institute been able to bring 3 drugs to clinical trial. One is an anti-cancer agent, specifically designed. I don't know if the mic's on.
Okay, just close.
Okay, better? Not much, right?
Hold it closer.
Okay. Okay, better? Okay, so it's the mic, not me. Okay. All right, so I was mentioning that we had 3 drugs that we have brought to clinical trial. One, an anti-cancer agent that's specifically designed for pancreatic cancer, and we named it Minolite. And so I guess it's the Minnesota in there. And so it's all across the country in clinical trials and also in foreign countries. We have co-developed a drug with Mayo Clinic for glaucoma. It's a new therapeutic that's moving towards the marketing. And then the third one is a non-hormonal male contraceptive agent. So that's a passion of mine. Yeah. And so people don't realize it. 45% of pregnancies in the United States and worldwide are actually unintended. And that's partly due to the fact that men have very little opportunity to participate in contraception, and they're limited to the condom and vasectomy, which is, of course, largely irreversible. And so I've worked for 20 years now on developing a male contraceptive agent, and it's now in phase 2 clinical trial. So I'm very much looking forward to the results of that trial, because it could be, I guess, it could be a big deal. And there's a lot of interest, and people sometimes say, oh, men are not interested, and that's not true. Men are very interested and would be welcoming such a new development. Maybe I'll stop there.
Oh, the second question, I have one more question.
Still for me, okay.
How has funding helped accelerate your work?
Yeah, so the funding is really mostly coming from the National Institutes of Health, which has, supported this work quite a bit. There's a philanthropic organization called the Male Contraceptive Initiative, and so they have been also providing support to me, but also to students. And so I want to maybe also just mention that it's very, very important to have student support. I work right now with 15 graduate students, and they all need to be supported. They need to have fellowships. And so these organizations, NIH as well as also the Male Contraceptive Initiative, have provided that support, but also support comes from the College of Pharmacy, and some, of course, comes from donor contributions to that. And so I guess we need support for the PharmD students, but also for our, graduate students to drive new research and innovation.
Great. Thank you.
Dr. McGee, I'll ask you the same questions.
Yeah.
Can you give us your elevator speech on the work that you're doing and what is revolutionary in your work?
Before I do that, could I get a show of hands of how many people are familiar with the health profession of occupational therapy? So quite a few, right? So I thought I might start by just giving like an elevator speech about like what is OT. And I know that there is awareness here, but I thought maybe I would give the perspectives of a practitioner, just in case that might be of help. So I like to think of us as handy persons, if you will, in the realm of daily activities, in that we can support people in achieving goals related to carrying out daily occupations, is what we would call them, and looking at what those barriers are. So we might work with people to address environmental barriers that are keeping them from doing daily activities. We might look at the individual's kind of person, if you will, to evaluate what their internal constraints are to doing daily activities. And then we might look at the activity in and of itself to look at whether or not it's a good match to the individual. And we do that across the lifespan. We do that with children all the way into older adulthood. And the other thing that we do that's unique, that I don't think is probably well publicized, is rather than exercise, and we do use exercise in our practice to help prepare people for doing occupations, but we actually use occupations as what we would say as a means or as a therapeutic agent. So, for example, a child who is looking to develop social skills or perhaps gross motor skills, we would have them do a play task that was meaningful and prescribed. That's just an example. For another example of that would be like in my world, which was like musculoskeletal rehab. If a person had a wrist fracture, I would work with the client to identify daily occupations or activities that were therapeutic that would be challenging for them, yet wouldn't exceed their medical restrictions, so that they could restore function of their wrist, for example. Okay, so those are just examples like how we do things on the adaptive side of the spectrum, but then also we use occupations to help restore people's functions, if you will. But my research in particular kind of falls into two spectrums. One is measurement research, in that I'm developing and testing measures of activity or measures of performance for one, basically to help identify disability when it's present, and then also to help serve as a marker of change in our clientele, so that we can actually document progress. And the second arm of my research is in intervention, development, and design, and some would call me more of a backwards translational scientist, in that a lot of the interventions that we use as occupational therapists develop out of the clinic, or develop based on personal experiences, or perhaps just our fundamental understanding of like the basic sciences or social sciences, but aren't developed like pharmaceuticals. It's not bench to clinic. It's kind of the opposite. It's clinic to bench. And so my work is doing that, where we presume things to work mechanistically a certain way, but I'm now evaluating whether or not that is in fact how our interventions work. So, for example, my primary work at this point is focused on people with hand osteoarthritis, and we use neuromuscular re-education sort of approaches to help people with this condition restore their thumb function in particular. And we are actually using computerized axial tomography to measure the kinematics or like the motion of the thumb joint to determine whether or not the thumb mechanics are changing in response to our intervention, which is what we presume it to do, but we don't know that is in fact the truth. And the reason that this is important is actually because thumb mechanics of the thumb joint are actually predictive of progression of the disease. So if an intervention actually can end up changing the mechanics of the joint, we might slow the progression of the disease down. And so I think that's probably my uniquest contribution, if you will, to science. And the thing that I'm most excited about at this point is it's evaluating the mechanisms of the work that we do in the clinic. That's, yeah.
Great. And how has funding helped accelerate your work?
Yeah, so I've been funded from a variety of sources, federal all the way to like departmental. It's been huge. It's allowed me to, of course, retain and recruit participants. It's enabled me to buy instrumentation that's necessary to carry out the work. Research in CAT scans is expensive work because not only does it involve certainly renting space, renting the time of a technician, but it also involves processing the data. And so we take this computerized tomography data and we convert it into 3D images, essentially, so that we can look at kinematic data in 3 dimensions, essentially. And so it's a very time-consuming process, and so that requires the assistance of like graduate assistants and others to make the work happen. And then lastly, the research supports graduate assistants. It supports their tuition expenses. It supports their healthcare expenses. It supports their stipend so that they can actually, get by, if you will. So that's the primary ways that I've utilized funding.
Great. Thank you.
Thank you.
Dr. Westberg, same question. Your elevator speech on your work and what is revolutionary?
Yeah, so I wanted to share some of our work coming out of our Office of Professional Affairs in the College of Pharmacy. And as many of our pharmacist alumni know, that we have a lot of challenges in pharmacy practice right now. We have challenges in reimbursement for dispensing product. We have challenges with underpayment for clinical pharmacy services and recognition of pharmacists as a billable provider within medical billing spaces. So, and we know that our pharmacists are well prepared and want to and are able to provide comprehensive care to our patients. But that can be difficult when you commit time to something and you're not paid for that time or inconsistently paid, which creates difficulty in creating systems to establish workflow when maybe this patient population would have coverage, but this one doesn't. And how do you establish that within particularly in community pharmacies? Many of our health systems are able to build some workflow in these spaces. And we have really wanted to, as a college, help advance that community pharmacy practice and identifying where these gaps are. And a lot of the gaps are sometimes in the communication between the health plan and the pharmacist provider. So we've hosted a number of plan provider summits where we've brought pharmacists who work for the health plans together with pharmacists who are providing the care. And we've built some small work groups around that have dug into different issues and identified educational needs. And there's amazing things that just happen in the room of, my claims are getting rejected from your plan. Well, what did you bill? Well, we billed this. Well, that should be covered. Why is that not working? Call me, email me, we'll figure it out. So we're sometimes there's really formal things that come out of that work, and sometimes it's about communication and connection and understanding that everyone's purpose is actually the same. It's for better patient outcomes and optimizing medication use. It's just we come at it different ways, whether we're at the health plan or at the community pharmacy or at the health system. So building those connections and relationships has been, I think, really valuable. I think our communities have said that's valuable. We've also used that work to help identify needs within our communities. So we've built, we have a program called PillRx, which is the Pharmacy Innovation Learning Lab, and it's a monthly, basically a webinar discussion targeted for community pharmacists to really just bring people together and talk about, here's a great thing I have happening in my practice, and this is how we made it work, and sharing that with other community pharmacists around the state who can ask questions, how'd you get past this challenge, or also just creating a community to understand what's happening. Sometimes we might be really geographically separated from other practice sites, or maybe the big bosses feel like we're in competition, but the pharmacists don't feel like they're in competition with each other, right? And so opening up that space. And we've also been able to form what we call the Rural RX Alliance, which is gathering our rural pharmacists. And this includes both community pharmacists and clinic-based rural pharmacists. And we've found that although comprehensive medication management in our big health systems in Minnesota is really advanced, name a big health system, and they have pharmacists in almost all their primary care and many of their specialty care clinics. That practice is way over here on the continuum, but our rural practices are a little back here. They have a lot of different barriers, different structure, different populations they're caring for, different payer mixes. And so if you're in this group and you're trying to learn from this group, it's like you miss everything in the middle. And that's what we've learned by gathering together rural pharmacists. And so we have Allison Knutson, who is leading our Rural RX Alliance, and it's a lot of coaching. It's a lot of, okay, you had this problem, let's connect with this particular group that can help solve that practice problem. And a little bit more nuanced in recognizing the nuance in rural care that's impactful. And so whether it's revolutionary, I kind of struggle with that word, but because I think all the expertise is out there. We're really trying to serve as a facilitator to bring together some answers. And our Rural RX Alliance, although we didn't predict this, has actually been a great venue to support the healthcare practitioners and the pharmacists in their settings as they think about the rural health transformation grants that are now open and for application, where those applications need to come from those rural health systems, but they're able to get together and talk about what are you doing and learn from each other.
Thank you. And how has funding helped with this work?
Yes, so we have had the privilege of having funding from our Jacoby Maury Fund that has actually funded Allison Knutson's time. So she's a casual employee with us and started off as a consultant, but she really built our Pill RX program, and she's leading our Rural RX Alliance program. And so she has dedicated time to dig in and do these needs assessments and talk with stakeholders and build those connections. And she and I connect regularly, and she's doing great work. And so we've been able to pay for the expertise to help move things forward with time and commitment.
Thank you. And Dr. Brown, your elevator speech on the work that you're doing and what is revolutionary, or we don't have to use that word, what is unique in what you're doing?
Yeah, thank you all so much. I'm really grateful to have the opportunity to talk with you all. So I'm a medical laboratory scientist, and my specialty practice area was clinical chemistry and toxicology. So clinical chemistry, if you think about most hospital, most patient laboratory experiences, your electrolyte panels, your fasting glucose, your glucose tests, your liver function tests, cardiac markers, it's really one of the engines of generating information to help clinicians understand what's happening with somebody's body. So if you think about student learners, I have two areas of research. One is about how do we help learners understand such a complicated field of information, like how we use laboratory tests to understand how every organ system in someone's body is working, all the different things that could go wrong, and being able to correctly identify that these laboratory values make sense for that patient's condition so we can release our information to the care team in a timely manner. And when is that information not making sense, and we should make sure we don't have an instrument issue, a test issue. So one of my areas of research is looking at interventions and learning. What can we do as an educator to help learners retain complicated information for longer periods of time? And where I think medical lab science is such a great model for looking at educational interventions and learning is because we have a progressed learning environment. We know exactly what courses people are taking. And so if I do something in my clinical chemistry course, I can see if the next course in the sequence, are there gains? And then we have a longer term retention of a board certification exam that gives us detailed information based on our subject area. So I've been looking at what kind of small interventions can I do as an educator 2 years in advance of their BOC or 1.5 years of their BOC, and being mindful that the professional year is very challenging, and so I want to be thoughtful in what kind of asks I'm having of my students. But I can get a lot of information that other educators can't get because they can't track outcomes 2 years from what they did something, right? So I think medical lab science is a really great model for looking at educational advancement. So that's one area of my research, is like, how do we help learners retain complicated information over long periods of time, because you need that for practice. And then the other area, because I'm so toxicology, so clinical chemistry and toxicology, I'm really an expert in small molecule analysis. And so I used mass spectrometers, which is a hard word to say, to measure things. And the beauty of mass spectrometers is they can be used to measure many, many different things, many substances. And in partnership with Angela Birnbaum's lab, I've been partnering with my knowledge of how to use mass spectrometers to measure small amounts of whatever substance to help her lab in developing anti-seizure medication panels using a mass spectrometer that's very sensitive, with the hope of being able to utilize self-collected blood specimens of people with epilepsy in challenging populations, such as pregnancy, where we're trying to balance how much anti-seizure medication that pregnant person has with that. We know that that medication is going to cause harm to the fetus if there's too much medication. And we also know if the person has a seizure during pregnancy, it's causing harm to the baby. But we don't understand the metabolism of the individual while they're going through pregnancy. So if we could collect blood more frequently, we could, one, create better models, and maybe we can guess better which person needs adjustments up or down in their anti-seizure medications during their pregnancy, or we can just monitor more frequently. So the Birnbaum lab is looking at these self-collected capillary blood specimens that a pregnant person could collect during multiple time points during their pregnancy, and then also looking at all other markers that they can collect and put into a computer database. But I've been helping with the development of the mass spectrometer method to look at these little bits of anti-seizure medication in small amounts of blood. So I think the revolutionary part is partnering medical lab science, where we're really experts in knowing how to measure things and how to have robust systems and make sure assays work properly, workflows, training, with researchers who have the interest in different case studies and different populations. And we can partner together because I can help build that mass spectrometer assay faster, help guide. I've trained so many medical lab scientists to do mass spectrometer testing. I can help train graduate students faster in getting that mass spectrometer testing up and running.
Thank you. And how has funding helped accelerate your work?
Yeah, so funding is really important for my work in medical lab science because it's small. And so these aren't the kind of, for at least the educational projects, they're not the kind of research I can get an NIH grant for. But I need help buying software or getting access to training so I can learn how to use more advanced statistical programs like R instead of using a spreadsheet to do data analysis, and also access to data. So I had small grants from donors in medical lab sciences and College of Pharmacy. I've been able to get money to buy access to data from a data pool from mHealth Fairview and look at hepatitis testing rates in hepatitis D testing rates in hepatitis B positive populations. The data is there in Fairview. I need to pay somebody to pull that out so we can look at the analysis and look at, can we guess properly based on risk factors when to do hepatitis D testing. That's not something I'm going to be able to write a whole grant up for, but getting a little bit of money to get a data pull from the department can help that research happen. And then on the Birnbaum lab, having graduate students and access to materials. Mass spectrometers are not cheap. They are very expensive. Their parts are very expensive. They're very complicated instruments. And so sometimes you need a large amount of money at once. That's not for one particular grant. So being able to have donor money to buy an instrument that we might use for the next 15 years on many different projects is super helpful for getting that research off the ground. And we wouldn't be able to do it without donor help.
Great, well, thank you very much. I think if people have questions, you can address the faculty after, so we can move on to our student panel now, but please join me in thanking our faculty panelists tonight. And I'll ask the students to join me up here. All right, for our student panel now, I'm going to ask each of them to introduce themselves and tell you what program they're in.
All right. Hello, everyone. Really appreciate the opportunity to talk to you guys here. And my name is Yu Ting. I'm currently, I just defended my PhD last month, and now I'm a, thank you. Now I'm a postdoc researcher in the experimental clinical pharmacology department and the College of Pharmacy.
Hi everyone, my name is Cora. I am a year 4 undergraduate student in the Medical Laboratory Sciences program, so I'm in my last year, my professional year, before I start my clinical semester and then take my boards and start working.
Hello everyone, I'm McKenna and I am an occupational therapy doctorate student on the Rochester campus, and I am in my first year and my second semester.
And unfortunately, our PharmD student was sick this afternoon, so he was not able to attend. So Yuting, I'm going to start with you. Why did you choose the University of Minnesota, and what was your path to becoming a PhD student in experimental and clinical pharmacology?
Yeah, I do consider myself as having one of the unique paths because I joined the College of Pharmacy since 2017 and as a PharmD student. So at that time, after I finished the first year of my PharmD training, I just feel besides the clinical knowledge and clinical training, I do want to have some research exposure, especially the translational and clinical research exposure if possible. So at that time, I reached out to a faculty member like Dr. Stephanie Huang in the ECP department, and then I became a research volunteer in her lab. And then, actually I was having a very, very joyful experience with her, and I was able to publish a research paper, before I graduated from the PharmD program as a first author. And then, after graduated with the PharmD program, I finished the board exam and have my pharmacist license, and I still feel very strongly like I want to do some translational clinical research, especially in the field of oncology. So I decided to join the PhD program and continue working with Stephanie, and that's how I'm here. And apparently I've been in the college for like almost 9 years now, and I'm very glad, I become more and more familiar with the people in the college and with the research, as well as seeing, how the college has been growing, within this period of time. So I'm really grateful for this opportunity.
I have a couple more questions for you.
Sorry.
What do you hope to do when you graduate, when you're finished with all of your work here?
Yeah, so right now I consider myself as having a more like a translationing postdoc position, and I'm actually looking for industry type of position, like in the either pharmaceutical industry or a biotech company, those kind of thing. And I think I'm very, very enthusiastic about oncology research, so I'm hoping to be a clinical scientist where I can, help pushing forward the new drug approval process for oncology patients, and maybe help design some more effective clinical trials. If we can identify certain biomarkers and recruit patients with certain biomarkers, there will be a higher chance of, having a success, clinical trial outcome, those kind of things. So I'm passionate about joining the industry and helping with the new drug approval process.
That's great. And how has having a fellowship impacted you?
Yeah, I think it means a lot. I mean, I was very fortunate to be able to receive a couple of, fellowships and scholarships from different levels. For example, from the department and from College of Pharmacy and even from the university level. So, for example, when I was a pharmacy student, I actually received a CTSI scholarship, which covered my stipend for the whole summer. So during that summer, I was able to have the protected time to do some cell line experiment with the cancer cell line and treat the cell lines with some drugs. So that became a very important part of my first author publication. And I mean, for my PhD training, I think it become even more important since, with the current funding issue, having the scholarship or the fellowship can really, some of them can cover my stipend and some of them can cover my living expenses and some of them can cover, some conference traveling, registration. So I'm able to present my research, posters, and oral presentations, those kind of things, and making network with people and knowing some job opportunities, things like that. So really grateful for the donors and the fellowships and fundings I have.
Great, thank you very much. So Cora, I'll ask you, why did you choose the University of Minnesota and what interests you in medical laboratory science?
Yeah, I am from Minnesota, was born and raised in Minnesota, kind of all throughout the state. And so I was always interested in the U, but what mainly drew me is the great healthcare facilities we have near the Twin Cities area. I knew I wanted to go into healthcare. I wasn't quite sure what I wanted to do, but we just have such great healthcare in Minnesota, and with like the Mayo Clinic and all of the Fairview hospitals here, there was just so many opportunities to do something healthcare related. I feel like if there's anywhere you want to do it, it's here, and so I was like, I really want to go to the U and pursue that. So that's where I did. And then as far as discovering medical laboratory science, I originally was studying biology for my degree. And then my sophomore year, I started volunteering at the medical center and then also got a lab position as an undergraduate research assistant in a lab that deals with high pathogenic avian influenza. And so kind of simultaneously as I started doing those things, I started volunteering at the hospital and actually was doing a lot of pharmacy runs. And so I was running medications from the pharmacy up to different units and vice versa. And I quickly realized that I just didn't know if patient care was for me. Just those interactions in the pharmacy, those that do pharmacy, kudos to you, because I just don't know if I could do it. And so then at the same time, the work I was doing in the lab really interested me, and I just so happened to take a course at the U that was an Intro to Medical Laboratory Sciences class as like a filler, because I just needed one extra credit, and I found out about the program here at the U, and I was like, this seems perfect for me, because I really enjoy the work I do in the research lab. However, I knew I wanted something to be more healthcare focused. The work we do there is very, very important, but is definitely more focused on chickens and turkeys and things like that. And so I was like, I would love to do some work with actual patients. So yeah, I applied for the program and then have been it ever since and have really enjoyed it. So yeah.
Great. What do you hope to do after graduation?
Yeah, after graduation, I hope to sit for my boards and pass and then start working. I definitely want to work for a few years as just a regular bench top lab and get that experience. I really enjoy microbiology, and so I'm hoping to get into that, but I think I'll pretty much take whatever I can get. And then as far as that, a few years from now, I would love to go back and get my master's in something STEM related, maybe public health, maybe something different. Still kind of open to exploring what comes my way. So yeah.
Thank you. And how has having a scholarship impacted you?
Yeah, scholarship has been so great and so impactful for me. I've been working 2 jobs since my sophomore year, both in the lab and then actually at Paisley Park, which is a really fun job to have. Yeah, I was like, I feel like I can disclose that, but it's funny, usually when I tell people I work at Paisley Park, they think it's an actual park. Like people, like my roommates were like, what's Paisley Park? I don't know what that is, but most Minnesotans know what that is. So having a scholarship has really relieved some of that financial stress I've had while working 2 jobs and given me more time to do things related to my schoolwork. For example, I'm the developing professional in the American Society for Clinical Laboratory Scientists of Minnesota. So that is like our professional organization that laboratorians have, and so being able to like volunteer through that and get more exposure to the clinical side and meet people in the community has been very beneficial, and I definitely would not have been able to do that without the scholarship and having some financial aid and relief. So yeah.
Thank you. And actually, the scholarship that Cora's receiving is the Janet Lorenz Scholarship. And Jan passed away a couple of years ago, and I saw her daughters sneak out, but her daughter and granddaughter were able to be here tonight, and they were able to meet Cora, so it was a very moving experience for them. McKenna, same questions. Why did you choose the University of Minnesota, and what interests you in OT?
Yeah, so University of Minnesota was actually my top choice, so I'm very happy to be here. There's so many reasons why I chose the University of Minnesota for occupational therapy. Specifically, I really liked that they seem to be the program that kind of pioneered the hybrid program, where we are partially in class and then partially doing the work on our own, which as a mom as well, that has made all the change of me being able to pursue my doctorate degree. And then also being able, when I was researching schools, I looked at the faculty, and I, really felt aligned with one of our faculty members who is in pediatrics, and that is where I have strong interest in, because prior to becoming an occupational therapy student, I worked at a developmental center. I'm also from Ohio, so a developmental center in Ohio that was age ranged from 8 to 89, and although we didn't have a lot of occupational therapy exposure, we had physical therapy, and I first learned about occupational therapy when we opened up our own school for the children at the developmental center, and that is when I really saw how life-changing occupational therapy can be for people who have differing abilities, and so that was really just eye-opening. And that's when I went to pursue my psychology degree, and then I went ahead and started working at Nationwide Children's Hospital at a behavioral health pavilion, and so I was working on a locked psychiatric unit for a neurobehavioral unit, and that's where I really saw how occupational therapy can make an impact in mental health as well, and especially in pediatrics. So I became interested in OT specifically in that realm because it was when I saw OT go into the rooms of these children who kind of are going through occupational deprivation from not being able to do their daily activities that they're used to outside of the hospital. OT brought the outside to them and really changed their lives in that moment, and that's when I was like, that's what I want to do. And so when I found the occupational therapy program at the University of Minnesota, and as a mother, it just kind of all worked out very perfect for me.
Thank you. And what do you hope to do after graduation?
Yeah, so my main goal is to kind of go back onto a mental health facility. I really want to get into preventative care in the sense of when I was at the residential center and the hospital, many of the children, they were supposed to be there from at the developmental center, it was 6 months, and then at the hospital, they were only supposed to be there for 2 weeks max, and then a lot of them were having extended stays, and I kind of really saw it was that they were losing their identities within their patient identity. And so after school, I would really like to try to prevent that occupational deprivation that I've mentioned before so that they can get back into their typical routines that can help them restore their identity. And then but on the other hand, I also did just partake in a NICU simulation that kind of really drew my interest that way too. And so I still have that in the back of my mind, especially as I learn more, and becoming a neonatal therapist would also be very interesting.
Sound like some great options.
Yeah.
And how has the scholarship impacted you?
The scholarship has impacted me immensely. I'm a first-generation college student, and so I don't really have anyone in my family that has made it this far, and so I feel having the support from all of the donors is immense, and then especially, like I mentioned, being a mother, and so I can have that balance between being a student and still raising my child and not having to worry about after school I have to go and work to, pay the bills and everything. And although, just any support that I can get has made this dream become a reality for me, and that's just more important than anything.
Thank you. Well, let's thank our great student panelists for joining us tonight. And I'm going to turn things back over to Kip to conclude our evening.
Thanks, Amy. Thank you again to everyone for joining us tonight. We're happy and grateful that we can share the evening with you and bring together the individuals who've been generously supporting us with those who benefit from your generosity. If you're here in person, please stay with us, mingle a little bit, chat with people, come meet students and faculty directly and get a chance to get to know them. And so to conclude, we want to do a toast, except we don't all have toast glasses. So I'll just wait. We have to coordinate this better. Amy's carefully getting the non-alcoholic one for me. All right. So on behalf of the entire College of Pharmacy, we toast you, our generous donors. Thank you for your ongoing support, the countless ways you help us to meet our mission, improve our lives, and advance the health of the people of Minnesota. Thank you. Cheers. Cheers. And that's it for the formal program. So as I said, please feel free to hang around, mingle, and meet people.